And if you're not familiar with AgeWell, Canada's Technology and Aging Network, I'm going to give you just a quick overview now before our presentation. So as a context piece, 78% of older Canadians are confident using current technology. 3 in 4 believe technology can help them in numerous ways, and only 2 in 10 use technology for health and wellness. So you can see there's a bit of a gap there, and this is a poll that was conducted by AgeWell with the help of Environics. And so in many ways, we try and bridge that gap. Our vision is that Canada's leadership in technology and aging benefits the world, and our mission is to develop a community of researchers, older adults, caregivers, partners, and future leaders that accelerates the delivery of technology-based solutions in order to make a meaningful difference in the lives of Canadians. AgeWell is a large network and truly a success story. So if you don't know me already, I'm Dorina Simeonov. I'm the Knowledge Mobilization and Policy Manager here at AgeWell. We have 42 universities and colleges across 8 provinces that are partnered with AgeWell, over 250 researchers, 755 trainees or highly qualified personnel, graduate students, and undergrads, 126 projects, about 80 of which I believe are active, and most importantly, 4,700 engaged older adults and caregivers at the project level, but also at a network level in an advisory capacity. We have 3 national innovation hubs and a growing amount of startups. All of these numbers constantly grow, so 35 startups as of last count. Where we try and bridge that gap and get some of these technology-based solutions into the hands of Canadians. So today I'm really excited to introduce Dr. Carrie Bourassa. She is the Scientific Director of the National Institute of Indigenous Peoples Health, which is a CIHR institute. She is also a professor of community health and epidemiology at the College of Medicine in the University of Saskatchewan. She's an adjunct in the faculties of education and kinesiology and health studies at the University of Regina, and is also the nominated principal investigator for the Canada Foundation for Innovation funded Morningstar Lodge, established in 2010 in Regina. As well, she is helping create a cultural safety evaluation training and research lab that will be built by next summer and hosted at the University of Saskatchewan. We're really thrilled to have her with us today to talk about this important topic, and I'll pass it over to you, Carrie.
Great, Miigwech, thank you very much for having me. It is certainly quite a privilege and an honor, and thanks for all of you for taking time to attend this webinar. I'm in Saskatoon right now, and so I do want to acknowledge the territory that I'm in. I'm originally from Treaty 4. I'm an Anishinaabe Métis, but I am living in Treaty 6 territory, the traditional territory of Cree peoples and homeland of the Métis Nation. And so thank you for being here wherever you are. So I'm going to talk today about the need for culturally safe dementia research model or models in Indigenous communities, First Nation, Métis, Inuit communities, and the development of training modules that we're hopefully going to launch in the next year or two, working at the direction always of Indigenous communities. So here's just to start off, this is a picture of community members. Some are from Morningstar Lodge, some of are the members from the communities that we serve. And right in the middle, you'll see between those wearing the red blankets is one of our guiding elders, Elder Betty McKenna. And we work, of course, with many elders and knowledge keepers. But this is part of the absolute need to ensure that spirit is always included in the work that we do, and I'll talk a little bit more about that after. But when we think about research, I think spirit is one of those aspects that is a little more difficult for some researchers to remember that it has to be included. And we think about mental, emotional, physical health, but spirit and spirituality is vitally important. So currently, there really is that need to implement ethical and culturally safe practices when engaging in research with Indigenous communities. And so you think about best practices in culturally safe Indigenous health research that have been developed to mitigate the existing barriers in health and health research that really stems from Canada's colonial history. So this webinar is really a brief examination of those best practices and reaffirms the need for culturally safe dementia research models in Indigenous communities. So I want to share a definition of Indigenous health research. Many of you may actually already be aware of this and have heard of this. I will focus more obviously on the research side of my appointment. I have a 50% research appointment at University of Saskatchewan and a 50% appointment as the scientific director at IEPH at CIHR. But this was developed in my capacity as scientific director when I took the position February 2017, and it came about because we were trying to understand how much research at CIHR was actually Indigenous health, and how did we know that? How did we know it was Indigenous health research? And so we brought together some of the very best folks that we could bring together to help us to understand, how to develop a definition that we could then apply and understand where were we at in terms of Indigenous health research. Because of course, Alain Baudet, the former president, gave us an action plan, and particularly IEPH an action plan to carry out, and that was to ensure that 4.6% of the entire CIHR budget was going to be Indigenous health research. And so we needed to certainly understand where we were going, how we were going to get there, and that started with understanding a definition. So I won't read the entire definition, but I have highlighted certainly where we needed to go, and that was to ensure that Indigenous communities were driving the Indigenous health research agenda in Canada, full stop, that it was about self-determination. And you can see that this definition certainly is in alignment with that, and that wellness is conducted by, grounded in, or engaged with First Nations, Inuit, or Métis communities. And so this definition now has been cited in a research context across Canada, as well as internationally. We were just in New Zealand with our colleagues there, as well as with our Australian colleagues, and certainly this definition is being adapted and used in other contexts. So I also wanted to talk about not only cultural safety, but of course, the link in terms of the root causes of ill health and why, we need to talk about cultural safety and understanding what cultural safety really means. So, the disparities continue to exist, and I certainly don't like to focus on deficit research. We do know that communities are really becoming beleaguered by deficit research, and we also know that communities are wanting to focus on research that is beneficial to them, that they know the problems in their own communities, and that often they feel marginalized by deficit research. So I'm quite reluctant to sort of talk about disparities. However, we do need to understand the context because we still, of course, are really not making many gains in terms of improving health among Indigenous peoples. And we have to understand why is that, and how are we going to close those gaps and make those improvements. And it certainly is not going to be done by the old models. It's going to be done by ensuring that Indigenous communities themselves are leading that research agenda, and that it is really about self-determination. But we do sort of have to face the reality that there are disparities, and that they are rooted in the legacy of not only historical colonization and intergenerational trauma, but an ongoing colonization that continues, and that there is really an intersection that is happening, this intersection that happens between the intergenerational trauma from residential schools and pass and permit systems and starvation, experimentation on Indigenous peoples, and that intersection between those historical legacies and the current ongoing colonial policies that are happening, which I don't think many of us have had the opportunity to really investigate that and think about that and understand how that is affecting not only us present day, but our familial generations and those yet unborn. And I think that is something we have to start to consider and understand how that is continuing. Because for me at least, I thought to myself, well, we're going to stop that colonial influence. That things are changing, and they are in many cases, but we haven't considered that ongoing colonial trauma, and how are we going to address that? And this really is about understanding the systemic issues, the systemic racism and the systemic bias. And this is how we can think about, at least in part, the role of cultural safety. We know that Indigenous peoples carry a high burden of health issues, that we suffer the worst health of any group in Canada, and that we experience the poorest living conditions and inequitable access to education, food, employment, healthcare, in a country that ranks in the top 10 in the United Nations Human Development Index. So we also know that this inequitable access leads to the worst health outcomes, but most importantly, racism is the identified factor that we have to really think about, and it reinforces the disparities. And as I just mentioned, racism is rooted in our colonial history, and we know that OCAP has cited this, and the TRC has cited this, and how many studies and how many more studies will we need to really get this and understand that we have to really focus on this. We have to focus on the systemic issues, not only in healthcare, but in every system, because it is completely rooted in our colonial past. So having said that, we also know that Indigenous people are resilient, right? We have a greater capacity to undertake research, and we have far more community engagement and direction than ever before. And so, one of the priorities at Morningstar Lodge is to engage Indigenous grassroots communities to ensure that the priorities really are coming from the community. It's their priorities, it's what they need. And I've always seen the work that I do as serving communities and ensuring that we take a strengths and asset-based approach, and that communities, they know what they need. And it really, we have to sort of flip the script a little bit here. And it doesn't mean that the academy is not important. Of course, partnerships are absolutely vital. But I believe that communities have the answers, and we need to learn and listen from the communities. So I'm not going to spend too much time on this. I think many of you are well aware of this, but I did want to include it, that research as exploitation is not something that is in the past. There continues to be a lot of exploitation still in First Nation, Métis, and Inuit communities. And a lot of helicopter research that still happens at marginalized communities, and I still hear from communities that will say, we're not really sure about how beneficial research really is. Research has to translate into beneficial services and programs, policy outcomes that are meaningful to those communities. We know that experimentation not only happened historically, but still to this day, DNA has been taken and used without the permission of communities. We know that sterilization still occurs and has occurred, and that is experimentation. So there are still so many issues that need to be addressed, and this research that can be so transformative now becomes something that is very ugly, that is harmful, and so it is extremely important that we understand these issues are still there, and that some communities may not be very open to undertaking and working with the academy in terms of research. And of course, a lot of research conducted without any kind of consent, not only for biological samples, but even just for sharing their stories. So as I said, traditional knowledge is often shared by knowledge keepers, and sometimes it's appropriated. There's a lot of discussion around pharmaceutical products and sacred knowledge that is stolen. So these are very important issues to consider. I don't want to spend too much time on this either, but these might be helpful. Many of you probably are already developing your own concepts and processes, but I think these are helpful guidelines when engaging with communities. Understanding that for many Indigenous communities, it really is thinking about reciprocity and what that really means when you're engaging with communities, and the idea that communities operate in a collective. It's not about individuality, and I can't think of a time where I've worked with a community and said, well, here's the proposal that I want to do, and sign on the dotted line. That's those days are long over. It is a long process to develop relationships, and communities need to be the ones that are telling us what they need, how they want the research to roll out, what they expect, if they want to publish, and what that will look like. It is really all about them, and how we as researchers would facilitate that, and the fact that they too are researchers. They are researchers, and that is so vitally important to understand. Giving back in a real way, what are you leaving there? What are you leaving behind? again, it is about what is going to benefit in the community. And community can be a very broad discussion. Is it on reserve? Is it an urban community? Is it a Métis community in the north? You know, it can be a national organization. You know, community can be broadly defined, but the fact is that it is what they define themselves as, and how they see the research unfolding and what they want. And some communities are very involved from start to finish. Some are less involved. The idea of holism, as I mentioned before, often we think about things in the idea around mental, emotional, physical, spiritual. Other communities have different dimensions, but it's really about, you can't have one without the other. The idea of responsibility, and I think about this in terms of being in the academy. It's the idea that, you know, if I'm going to work with a community, then it's my job to overcome some of the barriers, the systemic barriers in the academy. Things around, you know, honoraria, for example, you know, the research ethics boards, you know, all of those kinds of things that we know are hurdles for communities. It's my responsibility to smooth the way and make it easier for communities so that they don't have to worry about some of those things that we know are always problematic. And then, you know, respect. You know, in communities, I worked in palliative care for a very long time, palliative care research, and you know, you never have to understand everything in the way that we do things. It might seem foreign. We don't expect that you understand everything. It is just about respecting, you know, our processes and our protocols. But you'll never be forced to do anything. It's just a matter of we will respect you, and we expect the same in return. Because there's a lot of times where you know, we might end up doing ceremony, or we might ask for things to be done a certain way, and nobody expects that you're going to know everything. But it is just about that mutual respect. And then we have processes of capacity building. I'm looking for a different term because we've been certainly advised that, hey, everybody is human capacity, but it's more about, you know, what is it that the communities might want out of the research. Community, you know, actual community control. You know, it's you know, the community's actually saying to you, you know, this is what we want, this is what we need, and true, you know, I don't know how to say it anymore, just to say true community control. The community is actually really involved and really guiding that research process from start to finish. Authentic community engagement and collaboration, and cultural responsiveness. So that means that, you know, we know communities are very diverse, and so what you might, in terms of engaging in one community, you know, in terms of a service or a program or a model, that might look very different, you know, 40 kilometers down the road to the next community. But it has to be responsive to that particular community. And that means it's not one size fits all. So it could be very different. And we have certainly learned that, and I'll share a little bit with some of the partners that we have. So cultural safety was developed by a non-dominant Maori people, reacting really to negative experiences in the health and nursing system. And really what cultural safety does is just examine power imbalances and systemic issues. So it addresses institutional discrimination, colonization, particularly as it applies to healthcare. And it forces you to really look at your own personal biases. It forces you, if you're a physician or a nurse, somebody that has that power and authority, to examine that, to look at privilege, to look at the history, whether you're in New Zealand, whether you're in Canada, whether you're in Australia, and look at those relationships between healthcare providers and Indigenous peoples. And so that really forces you to have that self-reflection as well as that critical reflection. And it encompasses really all of the other work that has gone before it. It encompasses, the cultural sensitivity and all the other training that sort of has come before that. Cultural safety encompasses all of those other kinds of training that went before, and it sort of brings everything together. So cultural safety, though, really gets to the root of it. Really gets to that cultural, the systemic racism and the systemic issues, and puts a focus on patient and family-centered care. So here's a picture of Morningstar Lodge staff, File Hills Qu'Appelle Tribal Council co-researchers, and our Community Research Advisory Council members as well. And this is where we are undertaking community research capacity, or community research training, where we developed a new methodology for community-based research. And this is when we did our NACPA training. And NACPA is, it was originally called CDAP, and we worked with Dr. Judith Bartlett and Devin Dieter. And this was developed because we looked at methodologies, and you can adapt. There's lots of Indigenous research methodologies for analyzing or for collecting data. But for analyzing large amounts of qualitative data, there really wasn't, we couldn't find very many methodologies. And so it was very important to us, because we've been working with File Hills Qu'Appelle Tribal Council for over 16 years. We found it was, how are we going to include our co-researchers? How are we going to include our Community Research Advisory Committee all the way through this process? And so we adapted this methodology, because Dr. Bartlett had been using the methodology, but it was taking a very long time, and most communities could not commit to weeks and weeks of training and commitment to this. And so we developed a process that takes between half a day and a day. It was actually just published in a journal, and we're developing a toolkit. But this is really about community guiding us and saying, it's very important for us to be involved in all of the work that we're doing, all of the research. We have to be involved in all of it. And they review publications, they're named in the publications, they guide everything we're doing. And so we have now have this in line with OCAP principles and Tri-Council policy statement. But this is really speaking to self-determination, because if you think about it, ensuring that Indigenous communities are fully engaged in the data analysis, fully in line with OCAP, this is about them deciding how their stories will be told. Who gets to tell their stories? Who gets to ensure that their lens is on the data? It always should be the community members. And up until recently, it's usually just the research team, just the academics, but it must include Indigenous co-researchers. So it is really important to ensure the methodologies uphold Indigenous ethical protocols, given the poor history that I shared before. So this is our the Morningstar Lodge mentorship team. We're missing a few people. We have actually 15 people in our lab. The research that's undertaken at the direction of Indigenous communities actually can be very transformational. We actually spend a lot of our time in First Nations communities. We heard from Indigenous community research partners that while they're very happy to host us in their communities, it's sometimes difficult for them. First Nations communities are under-resourced, both in terms of human and financial resources. And one of our research partners actually made the point that they're often interrupted when when they're in their communities for team meetings, and they wondered if there was a possibility of creating, a safe space on campus. And they explained to us that they didn't see themselves in the university, but if there was a space created for them specifically, as well as for Indigenous students, then that would be something groundbreaking. And so they had the idea, and we had an obligation to bring it to life, and that's really how Morningstar Lodge came to be. It was completely community driven and one of the first Canada Foundation for Innovation labs. So it is, always we take direction from community, and this has helped us to create long-lasting relationships. This is our Community Research Advisory Committee at File Hills Qu'Appelle Tribal Council. And this is, as I said before, our guiding elder at Morningstar Lodge. And our community-based partnerships, we have some very long-standing ones. I mentioned File Hills Qu'Appelle Tribal Council is about 16, 17 years. All Nations Hope, I think we're going on over 18 years now. And I want to just share a couple of examples before my time is up. I think many of you are very familiar with OCAP, so I don't want to speak too much to that. But I do want to talk about a couple of examples before I'm finished. So we have 2 large projects that we are working on in partnership with our partners. So one is introducing new technologies to monitor the health data of older adults with multi-morbidities related to dementia in Indigenous communities, and digging deep, examining root causes of HIV among Indigenous women. So the File Hills Qu'Appelle Tribal Council and All Nations Hope Network partnered with us to bring a diverse group of First Nations community members to this Knowing Your Health Symposium. And this focused on traditional health to engage a dialogue around First Nations wellness, as well as reminding everybody that we employ Indigenous research methods, and community-based leadership informs the research. And this was, again, at the direction of community members. And so this was looking at an environmental scan that we conducted relating to participants' nutrition, exercise, and self-management at the symposium. And we distributed an anonymous survey there as well. So we had 136 surveys completed, which was way higher than what we ever anticipated. And the information will inform our baseline data going into the 2020-23 project. We use new technology, and believe me, I was shocked, but the community is very, very, very interested in technology, and they guide us when it comes to this, to anything to do with the technology. But they're interested in monitoring health data and bringing awareness around diet, exercise, and behavior in terms of the prevention of onset dementia. And especially at File Hills Qu'Appelle Tribal Council, they're very interested in the connection between intergenerational trauma, residential schools, and that connection to dementia, and how diet and nutrition can either be used as prevention, and how can we flip that switch and maybe stop the progression of dementia, and examine barriers also of access to health. So this is cultural safety is always front and center in all the work that we're doing. And so this is where they're talking about barriers of healthcare. They're also talking about systemic racism and stigma and bias. And in terms of digging deep, this was one of our first projects with All Nations Hope. It was a 3-year project. And I want to say that out of this project, a model was funded, and I couldn't be on it, obviously, because I'm a scientific director, but Margaret is a nominated principal investigator, Margaret Hiscop-Pieces, and she got a $1.1 million grant from CIHR to continue the work and employ the model. This is how it's supposed to work. This is self-determination. So we did partner on this project, and we had 148 women who participated in interviews and surveys. We hired community research liaisons we trained them and to do the interviews. And many, many women, I will tell you, many women had never participated in anything like this before. Many were afraid to be tested, and through the interview process, we were able to help women who wanted to become tested, and it was just a phenomenal project. We also interviewed 21 service providers, including, as well as elders and knowledge keepers were interviewed as well. I can't tell you how important that project was. This is why research, community-based research directed by Indigenous communities, is so important, because those women were HIV positive or had Hep C or both, and many of them had not sought out services because they didn't have good experiences. They had experienced stigma and racism, and they helped to build a culturally safe model of care. What would it look like if they could tell us what a culturally safe model of care could be like for Indigenous women who had HIV, AIDS, or HCV, and who had engaged in drug use. I mean, it was just an incredible project, and now that model is going to come full circle, and I hope that you have the opportunity to go online on our website and see some of the results. We're just doing the dissemination now. It's the absolutely totally community-based project that is going to make a difference. So I will leave it there. Thank you so much for your time, and Miigwech.
Thank you, Carrie. I'm going to navigate us back just a little bit on your deck, because there was a question about from Abby. She's asking, can you define what OCAP principles are, and what's the acronym, which sounds like NACPA, I think, NAPCAP, I think is what you were using, but just to define that acronym, let's see if I can, get back here. Just like a general, I know some people on the call know about this, but just as a general introduction for those who don't.
Okay, yeah, NAPCA is a tough one. I have to learn it, because NAPCA was translated into Cree, and I thought that I had it on my notes here, but I might have to get someone from my lab to I think it might not be in my notes now, because I thought I had it on my. I might have to get someone from my lab to send it to you, because for some reason it's not on my. But I have the original. The original name was the Collective Consensual Data Analytic Procedure, which is why we took it to ceremony. And I can, if you want, I can send you the Cree translation, and also the link to the article because it was just published actually in we wanted it in a mainstream publication. So if you have the email, Abby, I can send it to you.
Great. So we'll compile some of that once we get it from you, and we can send it out. And then the OCAP, I know there was a question that was part of the question to just defining what the OCAP principles are. I know they're kind of on that slide there, but.
Sure, yeah. Sorry, I just didn't want to run out of time. So OCAP is.
Okay, we've got lots of time.
Okay, good. Yeah, I was kind of rushing through. So OCAP is, it's a set of principles that were developed, I can't remember the year now, but OCAP is a set of principles that was developed by First Nations. It has really grown, and many First Nations now, courtesy of hardworking First Nations communities and First Nations Information Governance Center now actually does training. And all of our staff are actually trained in this now. And I would encourage you to go to their website because they have training and videos and all kinds of great documents. But they're really guidelines, and they help to understand, like when you develop a research agreement, for example, we always include not only the Tri-Council policy, because Tri-Council, in our opinion, doesn't really go far enough. It sort of says to many communities, well, you know, you could develop a research agreement, right? But you don't necessarily have to. And so for First Nations, you know, when we develop a research agreement, we'd put in OCAP because it is about self-determination. It is about nation building. It is really a political response to colonial approaches to information, because for so long, even today actually, many government agencies hold First Nations data, and they analyze that data, and they analyze it through their lens, right? Where if I'll give you an example. So we did an ATRAC study in Regina with All Nations Hope about 10 years ago. And it was good because the government was a partner, and they helped us to fund it. But when we did the analysis of the data versus what they did in terms of the analysis, it was like night and day, completely different outcomes in terms of our analysis. Now, why? Why? Because we're looking at it from a very different perspective. And this is why having the discussions when you're working with Indigenous communities, and in this case, particularly First Nations communities, you know, their understanding about data and about who is going to be a steward for that data, where that data will be housed, who has access to it and for what purpose is important, because communities can be very marginalized if data is interpreted in a particular way, and how it's going to be used. So you know, it is extremely important, and sometimes First Nations communities are just completely left out, and so where's that story then? Does that make sense? I hope that makes some sense.
Yeah, no, that's very helpful. So we've got a couple of kind of a handful of comments and some questions coming from folks. So I'll put the comments at the end, but just in terms of a question, we've got one from Mark, and I'm happy to chime in on this too, Carrie, asking how is AgeWell directly helping with culturally safe research, and what is the intersection of technology research and actual healthcare delivery services in Indigenous community, looking for kind of practical outcomes in daily lives?
Well, I think for us, you know, we've been doing a lot of capacity building, and really, again, taking direction from communities, and that practical, as you say, the practical piece is really not up for me or Morningstar Lodge to define that. It's up for the communities to define that. So you can see earlier on, I I mentioned what the project was that we're working on now with AgeWell, and we're really grateful because they want to see the outcomes, and we haven't really sort of mentioned diabetes particularly, but they want specifically technology to help them to have a healthier lifestyle, which they believe is rooted in two things. One is the colonial trauma, and two is the poor healthcare that they receive or don't receive. So for us, those are very tangible outcomes. Now I don't think we really have fully realized what technology can accomplish, and I think there's more to do there. But for me, those are very practical things. And on the other hand, we haven't I didn't even have an opportunity to talk about the support that AgeWell has provided for HQP in the lab. And I think there's more that can be done in terms of the community training as well, because as you probably maybe you don't know, but for us at CIHR, we aren't only investing in the academy, and of course we do need to build capacity in the academy. We know this. We know we need to build graduate students and postdocs and all of that. But we are serious about the fact that we need to invest in community researchers as well. So I think that's also something that is important for us to think about.
Great, thanks, Carrie. And if I can speak from a AgeWell network perspective, it's something that we're looking at more and more with the inclusion of equity, diversity, and inclusion principles and guidelines that we will have to follow. So we're actively kind of working on that at a network level, and there'll be more coming on that soon. Question on funding. So what funding is available to help researchers develop relationships with Indigenous communities to help develop ideas for research projects? Did you catch that, Carrie? I can repeat
sorry,
it.
I did. I thought that you were, sorry, I didn't realize that was a question for me.
No, it's okay. It's a question from Jeff. So he's asking if there's any funding available to help researchers develop some of those relationships with Indigenous communities, whether it's to help develop ideas for research projects or otherwise. And there's kind of a similar question that I'll kind of weave in here from Paula. So it's a bit there's a context piece, so I'll just give it to you. It says, I understand the hesitancy on behalf of Indigenous peoples regarding cold outreach from researchers offering opportunities to engage in collaborative research. She says, we have a research project on aging dementia and respect very much OCAP approaches. In the spirit of not leaving out First Nations groups, how can we locate potential First Nations partners and reach out in manners that are respectful? Is there, for example, a First Nations organization or group in Canada that can receive opportunities for collaborative research practice in health? Can AgeWell help to connect First Nation groups and researchers holding health research funding? So it's kind of two parts. Is there funding to help bridge those connections? Is there an organization, and what's the best way to go about all of that?
Okay, so a couple of things. There is a lot of Indigenous health research funding right now. I think the best thing is to really connect. I would say go onto the website, email jerrylyn.manitowabi and get onto our listserv if you're not already on it, because all of the funding opportunities related to Indigenous health are on the listserv. But the biggest opportunity, if you haven't heard of it yet, is the launch of the NEARS, and that's the Network Environment for Indigenous Health Research. So those have been announced. They were announced, I think, December 17th. there's one in every region, and the NEARS, those networks are meant to connect Indigenous communities with the Academy. And if you remember the NEARS that were discontinued in 2012, I think, those were originally based in the Academy, and some may still be based in an academic institution, but what we've tried to do is make them this time around. Communities really wanted the NEARS to be relaunched, but they wanted to ensure that communities had the opportunity, if they wished, to be able to really hold funds if they wanted to, and we are streamlining that process right now, but also for it to be community driven. So if you go on and look about, look up the NEARS, you'll see that it is very community driven in the spirit of what I've been talking about. And like the NEARS of old, you'll find that this is going to be a good opportunity to be able to engage with and develop opportunities for partners, either communities seeking academics or academics seeking communities. And so that I think will help a great deal. There are other networks as well. Of course, there's the Canadian Consortium on Neurodegeneration and Aging. There's AgeWell, and I expect that that they will also engage with many of the NEARS. And so it will be, if you're focusing in on those issues, I think the NEARS will actually be able to help with that as well.
Great. So I think we're going to do our best to gather some of those links and to that listserv and some of those resources and share them out with attendees after the fact. Just a reminder to everyone still on the call to fill out the quick evaluation for today's webinar. The survey link is now in the chat box. And I see that we may have gotten that listserv sign-up sheet maybe, but just to maybe wrap up, and if there's any outstanding questions, please do feel to type them in. There's a couple of comments from folks just saying thank you to Carrie, and that some folks have been following your work over the years. Yeah, it says thank you for all you do, Carrie. I hope to bring some of this important information to the death doulas that I train and mentor. This is from Olga. I'm aware of your work with virtual hospice, so I know that's some of the work that you've done, Carrie. And then from Julie, a couple of comments just saying that she loves the term collective you use. It's never an individual, hence takes an age for change management to occur. And yeah, just generally really positive comments from folks about some of the content and just the work in this area. So that's great. And I don't see any final questions. So we will do our best to share some of those resources that Carrie mentioned. And Carrie, I don't know if you've got any final thoughts or comments. Now's your chance.
Well, I just want to say, you can email me, carrie.bourassa@CIHR-irsc.gc.ca. I check my own emails, and I'm happy if you missed anything that you really wanted to get a hold of. I'm happy to send something through the email as well. So yeah, thanks very much for all of the comments, and I hope that it was helpful. So, and thanks very much for the opportunity. I really appreciate it.
You're very, very welcome, and thank you for a great presentation. You've got a couple of more comments just saying, thanks so much, always appreciate, and am encouraged and inspired by your work and suitedness as an Indigenous researcher. That's from Donna. Hope to talk to you soon, she says. And excellent presentation. Looking forward to the links from someone else. So thanks again to everyone who joined today's webinar and for all of your comments, people thanking you and your team, Carrie, lots of things coming in, that it's an honor to hear your talk, and I would have to echo that. It's important and powerful work that you do, and we're really lucky to have you as part of the AgeWell family. So thanks everyone, and we'll be in touch with some of that information. And also want to let you know that because this is the last webinar in our series, we are working on the next series. And if you sign up to our newsletter and keep an eye on our website, you will see some of that coming in the coming months in terms of upcoming webinars covering all that is new and exciting in technology and aging. So thank you, and have a great afternoon, everyone.
Thanks. Take care.
Bye.
Bye-bye.